All right, guys, so what I'm going to do here is walk you through what your dissection might look like and how you're going to go about identifying things inside of the heart. So something kind of important to keep in mind is that this is actually how we got the heart. I mean, it was frozen, but it's not a whole heart. So it's been cut into, I think, for safety, like checking and, all right, I'm going to get rid of this pool of blood for a second. All right, so it's been cut into because of like safety reasons to make sure it's not diseased or anything. So this is actually kind of what a heart would look like from the back, and then usually this is what your heart is going to look like from the front. And there's kind of this, I think that's actually the line where a coronary artery is going down through. So you can say if you're looking at somebody from the front, you can kind of put in mind, okay, so the right side would be over here, like you're kind of expecting this to be the right ventricle, the left side would be over here, and then if you're looking at somebody's back. But then, actually once you get in here, the most reliable way is to tell the two sides apart is to look at the thickness of the muscle. And so one thing that you want to be aware of, so like looking at this surface here, and in real life you can tell this a lot more easily. It's kind of shiny, like it has this layer, and that's actually epithelium, that like covering of well, we'll talk about the chamber in a second. This is, you can see it's like dark red. It's a muscle that's been cut into the middle, and that's what they've done to see if there's anything in here. So what some people sometimes like to do is, if this is not supposed to be separate, they might actually go and sort of pin it together with these little pins. So like that is supposed to be in there, and then obviously just watch out on the other side if you've got pins sticking out. And then this is even a little bit more complicated because this would be attached here. So it will be a chamber, and then this piece is actually going to wrap around the outside there. But the first thing that you want to try to do is figure out like where are the ventricles and where are the atria. And the really interesting thing in person is that the ventricles are most of the heart. So we're going to sort of like cut off this top part here in our imagination. Everything down is the ventricle. And then up here, you have to try to figure out where are the atria and then where are the arteries and veins coming into and out of those top chambers, right? So this chamber is actually going to be a little bit tricky, but we'll look at this in a second. So I'm going to go over to this other side here. This one's a little bit easier just because it's sort of more intact. So you've got this large bottom chamber, that's your ventricle, and then you want to start looking for what might be entrances and exits to that chamber. So the other thing you can do here, you first want to figure out what's your right and your left side. And you can even just take this in between your two fingers, feel the thickness of that chamber, and then you're going to compare it to this one. I want to go from the outside of the heart all the way into that ventricle. And there's one that's a lot thicker, and you're going to think, the one that's going to the body has to have more muscle because it has to push with more pressure to give blood that pressure that's going to go all the way up to the head or down to the feet and back. So I can tell that this is a lot thicker. This is going to be the left side, and then this wall is really thin. That's the right side. So notice that there is sort of a wall, or, well, it's a septum. So this muscle that's separating the two chambers, and that's going to be thick because it's sort of part of both chambers, right? It's part of the left, it's part of the right, it's in between them. So like the left side is going to have thick chambers on both sides, and the right side, the septum will be thick, but that outer wall between the outer wall of the heart and the chamber is going to be thinner, and so that's our right. So let's go over here and just look at, here is our right ventricle. And around the top, you've got all kinds of stuff going on, and you're going to try to figure out what's coming in to the right ventricle and what's coming out. And, sometimes even, like, I honestly don't know how many, well, like this, like, tube here, right? You can probably use your finger for most of these things. So, saying, okay, this looks like there's this little tiny piece that's a cut. But for the most part, right, there is a passageway coming from the ventricle up into this tube. And you can see that these tubes, they're a totally different kind of tissue. They're not muscle. These are the connective tissue that will tell you, okay, that's probably an artery or a vein. And then the other thing you're going to see, so up here, I think these look like little ears, but this is actually part of the atrium. And so notice that this is really thin, and then actually this is the other part of it over here. So you've got, like, they sort of look, if this was all folded up, right, it would be part of this. And it looks like this little flappy ear. The atria are not very thick at all, and they're going to be hanging out right at the top. They're not big at all either. Okay, so I've got my right ventricle, my right atrium, and then there has to be an exit, right? So you've got from the atrium into the ventricle. You're going to notice here that these are, so these little things, I'm trying to make sure you can still see here. So these are the chordae tendineae, and these are actually what's holding, so you're going to think, okay, in between an atrium and a ventricle. So this is a valve. This is one of the flaps of the valve. So they're really thin, right? The only thing pushing these open or closed is the movement of blood. They're not controlled by muscle. They're controlled by changes in pressure. So you're going to be able to find, so here's actually it's a pretty well-preserved valve, but that's, so another, and then it's the right side, it's the tricuspid valve, and actually the other part of it is over here. So you've got still chordae tendineae, and those are actually what's going to prevent the valve from flopping backwards as well. So you've got chordae tendineae, and then this is the tricuspid on the right-hand side, because normally this would be all together, right? So then we've got this other connection. So you've got, right, going from the right side up into this. So you're going to have to think, going from a ventricle out, because blood came in through the atrium, ventricle, it's going to go out. So you're going to think, okay, going away from the heart, that has to be an artery. And then you have to think, going from the right side, what artery is that going to be? And so you'll put that together and you'll say, okay, right side's going to the lungs, so it's going to be the pulmonary artery. And let's see here. Yeah, so then when you're looking for the semilunar valves, right, so you can kind of see, okay, here's the ventricle, and then here's the artery. So you're going to look for right at that intersection. This is what the semilunar valves look like. So they don't have chordae tendineae. They're just sort of attached to the artery. But the idea is that when the ventricle relaxes and blood's going to be going back, this is going to prevent blood from going back into the heart. So those are the semilunar valves. So I don't know that I'm actually going to walk you through the right side, because I want to leave some stuff for you guys to do. But the one thing that I want to point out to you guys is on the right side, or on the left side. So this is going to be the aorta. Same kind of thing, has semilunar valves. And I'm pretty sure you guys can see this. So there's these little, like branches or tubes that go off from here. And those are actually the beginnings of the coronary artery. So you can't follow them for very long with, tweezers, because they branch into these little arterioles that are going to go back around the heart itself. And then remember we said, like, this is, there's coronary arteries that break off and go to the muscle to bring oxygen to the muscle itself. So what I'm going to do in a second is take a couple pictures of this heart. But ideally what you're going to do in class is, you can go through and explain this to me in person. You can say, okay, this is the left ventricle, and this is the left atrium, and you're going to basically look for the four chambers, the valves, and the arteries, and then veins you probably are not going to be able to find. So if you look at this atrium here, it's pretty cut up. So honestly, I don't think I've ever seen a vein either into the left side or the right side, because usually the atria are so cut up that you can't even find them connected anymore. So don't worry about finding veins. All right, so I think that will help you guys. So yeah, let me know if you have any questions.